a very, very deep hollow in the temple. See? So that we need to address this problem. And if you look at the lower face, it's quite interesting. That's why you need a mirror sometimes, because if you look at her face to face, you won't see that. She's very weak, especially on the jaw angle here. See? She's very strong here, quite strong here, and very narrow. You don't see the jawline anymore. Here, something is missing here. Something is missing here. Less, mostly on the left side. So maybe we're going to adjust. We are definitely going to adjust the temple. Very important. Readjust the cheeks. Because we have adjusted the temple, we can readjust the cheeks. If not, if you just want to do the cheeks, you'll be tempted to do the cheeks without the temple. You disconnect even more the different anatomical units as we mentioned, which means you're going to increase the hollow. If you adjust this, you will increase the hollow in the temple. So you cannot do the cheeks without feeling the temple. It's a big mistake. And if we do that, temple, cheeks, you will see this look even weaker. So we need to readjust this because it looks like the jawline stops here. So this is missing. More on the left side than the right side. It's not so obvious on the right side. Okay, it's mostly obvious on the left side. Though something happened with the left side. You see, if I do that, she looks better. Okay, chin area is good, very strong, very pointy. Fine. So we're going to readjust temple, cheeks, and a bit of a jaw angle. Alors, need to draw. Please, I need to draw. Temporalis is a layered muscle. It's a fan, anatomically fan-shaped muscle made of layer that we call fascia. Okay, you have the and aponeurosis. So you have the superficial aponeurosis, the intermediate aponeurosis, and the deep one. So between these aponeurosis, these layers of muscle, you have fat pad normally. And that's what is aging with the aging process. These fat pads, like the disc, the vertebral disc, is melting. So suddenly the temple area is getting really hollow. So it's all about fat, again, like underneath the skin on the face. So we need to go underneath, in between these fascia temporalis, these layers, and reinsert the fat layer was missing. So you can use, so you have obviously 2 or 3 layers you can go. The superficial one, between the superficial and the intermediate, between the intermediate and the deep one, and really deep submuscular against the bone. Okay? So you have to be at the only risk, anatomical risk, you will study the anatomical area, but it's mostly the frontal branch of the facial nerve and the facial artery. That's it. But if you go slightly deeper, you won't be in trouble. Up, angle, no, here. So here the middle, plaque. So this is the eye socket. We don't want too deep. Plaque. Here, the angle is missing. Okay, something is missing here. Just is interesting to show you how you can do it. Okay, all right, let's go. Alors, I used Teoxane Ultra Deep for the temporal area. It's a good balance. Not too thick, not too light. So with the same needle hole, I will do the cheek and the temple. So you see I'm quite minimalist on my entry dots. Here. Same thing. Dilocaine epinephrine.
The anesthesia is important, or the vasoconstrictors? What's your main point in the
anesthesia, vasoconstriction? You have big veins. If I'm unlucky now, I'm going to catch one big vein and I have a big bruise. So it's quite difficult because I'm going to go deep with my needle.
Yes.
So the vasoconstriction doesn't really help. And you have big veins, so they won't be sufficient to stop that. Checking my needle. Okay. So, are you ready? Okay. So needle hole, quite deep. quite deep this time. That's a bit tricky. This is more technical, this area. It's not really easy for the first time. For beginners, it's not really a simple thing to do. So I go needle hole, I go deep, boom. And I can, you see, here I am. Can you see?
Perfect, yes.
Okay, look where I am here. Can you see the eyebrow?
Yes.
Eyebrow. So I can do an eyebrow lift. This is the best technique to do an eyebrow lift. So you don't need surgery for eyebrow lift anymore. You don't need to do the keyhole surgery because you can do it naturally. Because what you want is an elevation of 1 or 2 millimeters. Look, I'm going to work, just to show you, it's very interesting. I can lift the eyebrow. Look, all this part, because when you do Botox, Botox stops here. Okay? Frontal muscle, you lift this. So the more you do Botox, the more the tail of the eyebrow is going down.
Yes.
Right? So you have this discrepancy. You can't really raise always the tail of the eyebrow, and because especially if the temporal area is deep and hollow. So you need to restore that. So I'm going to lift now. I'm going to lift the tail of the eyebrow and do an eyebrow lift. See? Boom. Voila. So I go all around the eye socket. I reshape. Look, I'm here. I can reshape the eye socket. So you can do the work on the eye socket. See? I can really resculpt all the eye socket. I can go. And through this, I think someone else will have to give a course on that. But I can go also inside the eye if I want. You see? Underneath the muscle. Because I'm deep. This is like reconstructive surgery. I can be deep. I can go underneath the muscle. If I have a deep hollow eye, I can work on it. I'm underneath the muscle here. Okay? You see that?
Yes, very good.
I don't know. Put your, come here. Up, blah, blah, blah. Up, 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 up. Come close. You see, I'm underneath the muscle, right? You see where's my needle?
Yeah, we see it. Very good.
That to show you. So you can do everything we do with reconstructive surgery. It's possible to do the same thing with a cannula and fillers. And you get great results, okay? And no bruise. And no downtime. So now I'm going to fill the temple.
This cannula is 70 millimeters.
23 J.
Yes, 23, but
the
the
one.
length.
So look now, what I'm going to do is, I can go to my cheek, but as I show you, I was in a deep plan. Now I can go up, change, go superficial, and boom, I go in the cheek, right? So I finish my cheek. So with one syringe only, one syringe, I will do the cheek, and I will do the temple. I don't need to put so much necessarily. Okay, I think people have a funny idea about fillers, and I think they need to use lots of fillers. But sometimes with 1 mil, because this is a 1 mil, it's not even a 1.2 mil. That's why I like the 1.2 mil, because I need this O2 mil, extra O2 to finish my work. I feel more comfortable with the 1-2 mil syringe because I can do temple and cheeks with one syringe. So let me clean up. Yeah, take this away. So I've made a small restoration, not a very light restoration of the cheekbones. I don't want to increase too much her cheekbones. I think she lost a bit of volume on the cheekbones, but not so much. Look at the camera, maybe. You see the difference? You can see the difference.
Yeah.
Sorry. It's not. Now to look at the camera, maybe. Voila. Look at the camera. So you see, we fixed the temple area here, right? Okay. And now there is no discrepancy between the cheekbones and the temple area. It's like an infinity line, okay? Which you don't have on the other side. Okay, let's do this. It's a bit complicated, all this. I can put a little bit more eventually on the cheeks. Maybe I'll do it at the end. Same thing, the other side. Yeah, keep all that for me. Let's be lucky. Sometime we can have some. You can see. Pull that for me. I don't see anything. Voilà. I try to start behind the hairline, okay? Because in front the hairline you have a big, big vein, and it can be a major bruise sometimes. See, same thing. I go into it, I dive into it, I dive. Look at my hand, soft. Okay, flexible cannula, as you can see. I dive and straight, boom. Where am I? Here, ooh, on the eyebrow, right? You can see? Can you see? I'm here.
Yeah, we can see.
Okay, so I correct my trajectoire, and I'm going to go here, lifting the eyebrow, feeling the hollow in the forehead area. So you see, you do facial reconstruction now. So it's more sophisticated than you think, facial sculpture. You can do much more. You can do, it's like surgery, you know? You can go. So that's why facial sculpture is a new world. It's not just injection, basic injection. We're far from the basic injection with the concept of reconstructive surgery. I'm a surgeon. I've done reconstructive surgery for years. So I'm quite comfortable with this area. But see, I do all the plan.
Can you leave out this hand? Then they can see more. Maybe the camera can see more.
Okay, I do. Can you see more?
Yes.
I'll try. Okay, you see?
Wonderful, thank you.
So one thing you need to know, because the filler comes with lidocaine, I'm crossing the facial nerve, the frontal branch of the facial nerve. All right? So you may numb this nerve. So don't panic if when you finish the procedure, the patient cannot lift the eyebrow and it's all paralyzed. Don't be panic. You haven't hurt anything. You just numb the nerve.
Yes.
Okay? This happens quite a lot. Okay? So you look at the patient and she says, oh my God, I can't lift my eyebrow. She's panicking, and you start panicking with her. Say, what have I done? What have I done? You haven't done anything wrong. Okay? You can't cut anything with this blunt cannula. You just numb the frontal branch, okay, of the facial nerve. So don't panic. So I do a bit more here, you see? Ah, sorry. And now, just to show you, I can go out, of course, I can go out and change my plan, but I can also turn around. Go. When I turn around, I don't stay in the same plan. I go more superficial, and I slide into the cheek area. And I start doing my cheeks. I think I'm going to put a little bit more because it's not enough. You see, I'm not comfortable with 1 mil syringe. I'm so used, my brain is so used to 1 mil, you know, exactly. Yes. You know, when you get used to, it's a funny thing. You totally, so I'm used to 1.2, so I need this one, this O2. You see, I can go out and go back to simply to my area, always knowing where's my way out. It's here, on this blue cannula. I know exactly.
So you want the hole to look outside, to the outer surface?
Facing you, yes. I think needs a bit more here. And I will put a bit more on the other side to finish the work. You see, I can go back to my previous hole. They close very quickly, these holes. And now we'll finish with the jawbone angle, because need to be readjusted. Pas fait l'anesthésie là, no? I didn't give me. Okay. Need to make a needle hole here, in front of the ear, in the line. Okay. Maybe I'm going to use some Ultimate for that, because I need strong filler. Just before I show you, and I'm going to check the symmetry of my cheekbones and my temple. And I'm going to see, I can sculpt, massage, and you're going to show you I have lift my eyebrows too, the same way. Attends, be careful, Christine, please. Voilà, I think she's quite good. No? It's fine, no?
Very good.
See
Very
the temple?
good
Look, great. That's really nice. Look at the eyebrow, lifted. All joined up with the forehead. You see, Think about the puzzle. Everything has to join up together. See, if you keep this line, it's very interesting. You see, same line. Okay? You have a kind of, no, go backward. An infinity line, you see? Oh, two. It's fine. So now I'm just finishing one side here, slightly asymmetrical, to balance the jaw angle. You see, if you look at her, she looks stronger here than here. Something is look like missing here, like the little problem. So just going to finish that quickly, and it's a way also to show you how you can play with the mandibles. So, which I do, you can, it could be more obvious sometimes on certain patients. Needle hole, same. Always invisible. You see, all this work is completely invisible. Huh? Okay. Oh, yes. Where's the way out? Tack, introduction, go. I can do a jawline. Look, boom. I can restore my jawline here. Oh. You see, these needles sometimes they're too flexible. Voilà.
Now you're using the Ultimate product, right?
Ultimate, because I need something a bit thicker to do this work. Voilà. See, I can restore the jawline. I can restore the loss of volume in the lower face here. Very interesting. Very interesting.
So you are always in the subcutaneous layer?
Yes.
Okay.
Sculpting. And it's perfect. Look, a new jawline. Better than, see, you don't need reconstructive surgery anymore. Stand up, come here. Voilà. See? You recoup your angle. You see the difference?
Yeah.
Do you see the difference? She's balanced now. Symmetrical. Smile. Same. See the strong? Voilà. Something. Look at the angle. It's so nice. Lovely shape. Lovely jawline. Looks like a facelift. Lovely jawline. Perfect cheekbones. Lovely temple. And you see the temple brings some light to her eyes because you had shadows and light. Remember what I said when I started. Shadows and light. This area, when you improve the temporal area, you'll bring light to the eyes. Look at the beautiful eyes now. Huh? You see? Enlightened. Perfect. Great.